But first I'm joined by Professor Malegapuru Makgoba, who's had a varied career as a Vice-Chancellor, immunologist, Eskom Board Chair and our Health Ombud. Professor Makgoba, thanks very much for your time today. We've had 6 health ministers over the past 30 years. How's that impacted on health policy?
Each one of them have left a fingerprint of their existence in that portfolio. First of all, we had Minister Nkosazana Zuma, who set really the blueprint for the national health system in South Africa as we know it, by amalgamating the different health systems that existed in the homelands and in the various provinces. She is popularly known for having abolished smoking in our country and made it a healthier environment. She was then followed by Minister Shabalala Msimang-Manto, who was part of the AIDS denial era and really almost took us back in trying to address the pandemic of HIV and AIDS by pronouncing certain funny remedies for the treatment of HIV/AIDS. And she was followed very briefly by Barbara Hogan, who actually terminated, I think, AIDS denial.
So as you've mentioned, people like Nkosazana Zuma did great things in terms of policy, but there was also bad things. There was Sarafina, the scandal.
Correct.
And same thing with Zweli Mkhize. Yeah. He got lauded for how we handled COVID, but yet there was corruption.
Yes.
How do you view this? How does that impact our health system?
It appears, as many people have said, that corruption is in the DNA of the ANC. So it is no surprise that there is so much corruption. What one can say is that we put a lot of ideas into how the new health system should be. And lots of ideas, lots of policies, but it is in the implementation of those policies that we have failed. Right now, we have been debating the national health insurance. Everybody accepts that this is the best policy, and this is almost a transformative policy for the country. But where is it bogged down? In the debates and the contestation of governance, of how it would impact on taxation, how doctors would migrate from the country if it's brought into being.
What is your take? Do you think it's really the answer to our health problems to fix our two-tier private and government health system?
Health, wherever you look at it, whether you are giving it universal or not, it's expensive and it has got these elements that are often not all in harmony to provide the best service that you can get. Now, I noticed that the minister has said that we should implement it in an incremental manner. You have to do it empirically. You learn as you go. Let's get a few centers accredited properly.
Let's look at our current system. As you've mentioned, there are many gaps in it. And you've been the health ombud for 7 years, until quite recently last year. And you supervised investigations such as Life Esidimeni or the working conditions at Rahima Musa Hospital in Johannesburg. What does that tell us about our health system?
First of all, it's got a leadership problem across the provinces and across the many hospitals that one visited. There's a leadership. There is a problem of governance. There is a problem of infrastructure. There's a problem of staffing, a problem of attitudes of professionals within the system. So we have a multiplicity of problems that I think hampers the national health insurance and the health system.
Just as an ordinary citizen of the country, do you feel sad when you look at that?
Well, I feel sad, but I don't feel that I should then lose hope. South Africa is my home. Like every South African, I want to live in a country that is successful, that is flourishing. I am sad that some of the things that I have recommended have not been taken forward.
Which things have been taken forward that you're happy about?
For example, in the Life Esidimeni example, The government, I think, admitted that they had committed a lot of what I call human rights violations. The Gauteng department admitted that. I made my recommendations from Life Esidimeni, and Ketani lost her job. And so did the senior level of that department. Dr. Silebano lost his job. Dr. Manamela lost her job. Several of the directors lost their job. Now, I'm not saying that that's adequate, but that's one form of a response to the recommendations that one should look at.
Now, you've lived through many stages of health in this country, and one of the most controversial and difficult stages was the HIV denialist period. I remember it myself as a reporter reporting on it, and I remember that you were one of the few prominent figures who were willing to speak out and take a stand.
What was really for me the most disturbing thing was that politicians in our country had the guts to think that they can define and determine what medical professions understand as a disease and push through the political power to determine the direction of health.
Do you think we've learned our lesson, that we've learned politics should not triumph science?
No, we haven't. It continues. It was the same thing in the Life Esidimeni. Politics was trying to triumph science because the former MEC had received so many advice, not only from the relatives of the patients, but from experts who were practicing in this field, psychiatrists, name them. They were all advising against this project that they were undergoing.
So, Prof, lastly, if you became South Africa's health minister tomorrow, what would you do in your first 100 days to fix some of these things?
For argument's sake, if I became a minister tomorrow, the first thing I would do is to have a CODESA on health. I would call all the stakeholders that are relevant to health and say to them, we are in a new country. We have a new constitution that is based on human rights. How is that reflected in the way we teach medicine, in the way we practice medicine, in the way we provide service in our country for our own people, in the way we write or rewrite the ethics within this new constitution, and begin to say, we are transforming South Africa's health.
Professor Makgoba, you've borne personal witness to so many events during our 30 years of democracy. It was really good to hear your views.
Thank you very much, and all the best.